New tonight, the U.S. death toll in this pandemic has surpassed 800,000, more than any other country in the world. Those numbers coming from data compiled by Johns Hopkins University, and that number, 800,000, is equal to the populations of Atlanta and St. Louis combined. That means the United States, which only accounts for 4% of the entire world's population, accounts for 15% of known COVID deaths since the pandemic began 2 years ago. Johns Hopkins also reporting more than 200,000 of those deaths came after vaccines became available to all Americans last spring. Tonight, drug maker Pfizer is offering some hope on that front. It says preliminary data shows that its anti-COVID pill taken after the onset of symptoms is nearly 89% effective and shown to significantly reduce the risk of hospitalization and death in unvaccinated high-risk patients. Newsy's health and science reporter Lindsay Thies explains why that's so significant and what this could mean for the fight against COVID. Lindsay.
Pfizer released findings today on 2 studies for their pill Paxlovid. The results will go to the FDA, who will soon take up if and when Americans could use this COVID medication. Pfizer says its COVID pill is highly effective and holds up against Omicron. In a study of more than 2,200 people, Paxlovid was 89% effective in lowering hospitalizations and deaths. When researchers broke it down, 700 high-risk patients took the pill within 3 days of initial symptoms, and only 5 people went to the hospital for COVID. Within 5 days of symptoms, 8 out of 1,039 people were hospitalized. No one died. Unvaccinated or vaccinated, this 5-pill regimen taken once a day could make a huge difference.
That's really good news. So it's holding up under larger numbers of people. So they're going to be submitting that to the FDA, and hopefully we'll get some action on that soon.
Pfizer says it can have 180,000 courses of Paxlovid on the ready once authorized, and 80 million worldwide by 2022. This COVID pill is the second up for emergency authorization from the FDA. Late last month, an FDA advisory committee narrowly voted to recommend Merck's COVID drug. Merck's pill reduces hospitalizations and deaths by 30% in high-risk adults, but Merck and FDA findings showed it could potentially lead to pregnancy complications and birth defects. The Pfizer development comes as COVID-19 cases, deaths, and hospitalizations are increasing again. The surge is caused by the Delta variant, colder weather, and more indoor gatherings. Health officials are also watching the emerging Omicron strain in 30-plus states and counting.
It is going to spread like wildfire across the United States, and we got to be ready.
Pfizer shared results from a second study showing the pill is still potent against the Omicron variant. Important because early lab results show current monoclonal antibodies lose most of their effectiveness when exposed to Omicron. Pfizer has a rolling submission with the FDA on this drug, meaning that as they get results and data in, it gets reviewed to the FDA, and pretty fast. The same advisory panel that recommended Merck's pill will look at this one too. That date hasn't been set yet, but we do expect it to come rather quickly. Back to you.